Hi, good evening, everyone. I hope you all are having a good and restful Sunday. It's been raining quite a bit. I hope you guys are all safe and I hope you all are doing well. Um, Today we're going to talk about eye problems. Okay, so in dogs and cats mainly is what we're going to talk about. And my very good friend is joining us today. Her name is Dr. Pallavi Kelkar. I am very excited that she's going to be a part of this. And being Guru Purnima today, I actually want to thank her for many things she's actually taught me. Like because we were in veterinary college together, and since college we've been studying together. Used to travel together, and even after college, she's helped me out a lot and taught me a lot of things, even at my own clinic. So I'm very excited to have her today. It's very special to me, and she currently works at the Eye Vet, which is a veterinary clinic which specializes only in veterinary ophthalmology and ophthalmic surgery, which is run by Dr. Kasturi. They have a branch here in Mumbai, which is in Chembur, and they also have a branch in Pune as well. And without much further ado, I'm going to add Dr. Pallavi into this conversation, and let's start talking about eyes. Okay, we're just waiting for her to join in. Hi,
Hi,
Doctor. How are you?
good. How are you?
I'm good. How are you doing in this rainy weather?
Today being Sunday was quite a good chill out day at home.
Yeah, can you
Can you hear
imagine?
me properly?
Perfect. It's all good.
Okay, great.
Okay, so I think let's just start with just some of the basics. I think a lot of people don't understand, when something is wrong with an eye, or, there are a lot of parts involved in the eye. Like you might think
Yeah,
something wrong, but it's not actually what's going on, obviously, which is why you need to see an ophthalmologist. And I'm sure even a lot of veterinary students would just want to know just the basics of the eye. I mean, we won't get into too much of the anatomy, so could you
sure.
just tell us the basic anatomy of the eyeball?
Yes. So I do have a basic eye diagram here, which I would like to show. I mean, as you said, let's not go into too much detail and bore everybody with an anatomy lecture.
Yeah.
But so let's see if you can see this.
Yeah.
Yeah. All
Yeah,
right.
it's perfect. Oops, it's gone. Okay. Okay,
All
you'll
right.
have to only, because since it's a mirror image, you'll just have to explain what's written on the
Oh,
diagram.
right, right.
Yeah.
So, the eyeball is basically a squishy structure, very fragile, and just to go into very basic thing, this is the front portion of your eye. So, imagine you're seeing your dog or cat from sideways, and this is the front portion of the eye, which is the cornea. Then is a fluidy layer inside, followed by the lens again, which is jelly-like and has to be transparent. This is the back chamber of the eye, which is filled with vitreous. Again, a very jelly-like structure, and it gives shape to your eyeball. Back at the back is the retina, which is a very thin membrane, and that is the actual neurological structure in the eye, which catches the light and via this optic nerve sends it out to the brain. So it's a very compact, dynamic structure, and everything needs to be in the perfect location. Everything needs to be transparent for the dog or cat to perceive light and perceive an event. So it's very
Okay.
important that
Yeah.
the eye always tries and maintains this transparency for them to do that.
Okay. Yeah. Of course. And so let's talk about some of the most common things, like when you should visit a vet. Obviously, of course, if there's anything wrong, you should first go to the vet. But what are some of the most common things that we get to see, especially with your dog and cat patients?
Right. So, the most common thing that comes to us, or you may have seen in your clinic as well, is a discharge.
Yeah.
Somebody calls you saying that my dog has a discharge. So that's the most common thing we get. Another other signs to look out for are, a haziness in front of the eye, or some injury or hair sticking into the eye. The
Hmm.
most like pain should be an alarm bell in your head. Kind of pain. So usually they show it by squinting their eye, squinting their eye a lot with a charge, and that's an alarm bell. You have to try and get to a vet or an ophthalmologist as soon as possible, because that time is of sense at that point, and the sooner they get a good diagnosis and treatment, can be really vision in such
Yeah.
cases.
Yeah, I think
So
the sooner, obviously, yeah, prevention is better than cure, especially when it comes to the eye, because obviously it's one of the most important senses, uh,
yes,
even in
and
animals. Yeah.
things can go
Yeah.
wrong pretty quickly. It can go downhill quite quickly, but also if they get it in the treatment in time, it's a very responsive organ. We have seen wonders happening with just a little bit of medication and stuff. So
Yeah, yeah, yeah. So I think a lot of times, what people even sometimes take for granted is like, oh, it's just a little bit of watery eye, or just a little bit of sticky discharge that's
right,
coming out. It's probably just some dust or something that's gone in. But
right.
I'm sure it can be a lot more serious if you don't
Definitely,
take that in time.
definitely. Their eye
Yeah.
symptoms tell us a lot about stuff. If you keep looking into your pet's eye every day, minute things you can catch very early in time, and that can be really good for them.
Yeah. And so, some, if you can just tell us some of the basic causes, like, say cause for just a watery eye, or if
Right.
there's discharge, like what causes can it be?
So, for example, a discharge, a minute discharge, a whitish mucoid thing, or a watery discharge can be a sign of dry eye. Dry eye is the most common thing that we see, especially in breeds. We will talk about breeds later, but especially in breeds like beagles or Shih Tzus and pugs, they get this issue called as dry eye, where the tear production is very low, and that's why they get this sticky discharge. Of course, you must have experienced, any human has experienced dry eye. It's very irritating. So the owners usually see a discharge, and the dog is constantly trying to rub at his eye,
Yeah.
very irritated. And at that point, uh, some some lubricant eye drops are good enough, but the dog or cat needs his own tear production to be
Yeah.
boosted. Tears are very good. They provide nutrients. They provide antibacterial, material to
Hmm.
your eye surface, and their own tear production is very important. And there are medications to boost their tear productions.
Yeah.
So
Yeah.
that is
So
one
that
thing.
obviously needs to be first of all diagnosed correctly.
Yes,
So like what are the few things that I am sure people would be curious to know, like what does a veterinary ophthalmologist actually do? Like you have a dog or cat coming into your clinic, and so what do you do first? They say, okay, my cat's eye has been watering for a week.
right.
Okay,
So
so
most important, yeah, is to ask them questions. Is it acute or chronic? Acute things are, some irritation or injury or things like that. So we first see them, see their behavior, see if the cat is in pain or the dog is in pain, and then we do a series of tests to, come to a diagnosis. We check their tear production. We see if they have any eyelid abnormalities. Most of the times, what happens is we think it's an eye issue, but it's actually something related to the skin around the eye or some eyelid abnormality. So we need to look closely around the eye as well. So we do that. Then we do a few tests to see whether there's an injury or whether there's an ulcer or deep ulcer, things like that. Or if we see the lens, we have a microscope. It's a
yeah.
handheld microscope. So we see the lens, we see the retina, and we
I mean,
also check
also exactly what your human ophthalmologist would do,
everything that you would
pretty
do.
much. Yeah.
Yes, yes.
So,
Of
I mean,
course.
it is a complete checkup of the eye,
Yeah.
from the cornea to the lens, and
To
you
the back
obviously
of the
have
eye.
to use specialized instruments for it.
Sure.
Even
Yeah.
to check the tear production, the Shermer tear strips
Yeah.
is something that's important that you would be
Yes.
using. So, yeah,
Definitely.
these are some things which is why it's so important to see a specialist when it comes to certain issues. It can't all just be a common cure all
Yeah.
uh,
Yeah.
for things like this. So what are the signs that people should watch out for? Like, that they should know that something is wrong with the eye.
Hmm.
So, what
Hmm.
are some of the signs that people should you look out for at home?
So, especially with this lockdown, we have had a lot of clients who have the time to really
Actually, look.
and they come up with which is quite good. We need to do that every day to catch it early. So signs like discharge, watery discharge, redness around the eye or in the eye, or as I said, the cornea, the front portion has to be bright and moist. So sometimes that can show some haziness, which can be because of a host of issues that need to be diagnosed. So it can be a pressure issue or an ulcer, things like that. And pain. Pain,
Pain. Yeah.
yeah. I mean,
I
that's
mean,
the
I'm sure
first
like
thing that,
any eye condition, we sometimes might not realize how painful it is, but it is quite painful. So, I mean, signs of pain would be them pawing the eye
yeah,
or
pawing
probably
the eye,
probably,
squinting it, and
yeah.
discharge, watery discharge.
And of course, even there'll be a behavioral change in them.
Sure. Yeah, yeah. With pain, especially pain like plain pain with glaucoma, where the eye
Hmm.
pressure increases. So there are different kinds of pain that they show. An ulcer would be that they're really squinting and watery discharge, but as opposed to glaucoma, they will also become very white because glaucoma causes a headache kind of pain.
Yeah.
So their behavior really dulls down with
Yeah,
that.
and they can't tell us about it, which is why we
Yeah,
need the diagnostics. Yeah.
sure.
So, how often are you even seeing glaucoma cases or diabetes related ailments as well, eye ailments as well in pets? I'm sure that might be fairly common.
Right. Right. It is common. I mean, we haven't seen primary glaucoma as such, but secondary glaucomas, yes, we do get it commonly. It could be anything like a lens fluxation. We just had a case of where the lens dislocates in front of the eye. That's again a painful thing. The eye pressure shoots up.
Yeah.
Um, Otherwise, we have seen glaucoma secondary to retinal detachments. So yeah, I
Hmm.
really want to talk about retinal detachments, our eye conditions second to tick fever. So tick fever also can cause glaucoma. You need to check that animal, check his blood, then a thorough check otherwise as well to rule out tick fever. That is a very leading cause, I would say, of glaucoma that we see
I
at
think
the
that's
clinic.
great even for other practicing vets to know what to look
Yes.
out for if they have a tick fever diagnosis.
Yes.
They should definitely check out the eye as well.
Absolutely, absolutely. So, we've had quite a few bad cases where I mean, it's an acute blindness and painful eye combined. So that should ring a bell that, oh, this could be, we need to check this dog or dog actually
Yeah.
thoroughly and not just the eye, the dog
Yeah.
attached to the eye as well.
Okay.
Uh,
Yeah. Yeah, okay. So, also, okay, a lot of times, I mean, now, especially dogs getting older, we see a lot of cataract in
yeah,
dogs as well. And also sometimes what might look like cataract isn't cataract.
yeah,
Uh, so
absolutely.
could you help us differentiate between the two?
Sure. So, not all dogs get cataracts. Cataracts are hereditary in dogs. They get something called as lens degeneration, which is age related. So that would look like a haziness in the eye. Maybe we can share a few pictures later,
Yeah,
rather than you can show it on your page. Maybe that would be very helpful later. Yeah. So it's a lens. The lens becomes hardened And like how in humans, when you get when you turn 40 and suddenly you have focusing issues when you are trying to read. So that's what happens with dogs as well. When they get this nuclear sclerosis, there is hardening of the lens, and it's seen like a bluish haze in the eye. So most of the owners or vets sometimes can think that it's cataract, but it's not. It's good news. It's not cataract. So cataracts are seen like a bead, white, very white crystalline bead kind of thing in the eye, and that's how you would differentiate. We'll definitely share pictures about this because it's a common thing that we get at the clinic where people are talking the cataract. It's not
Yeah,
really cataract.
I think yeah, most people will think like, okay, cat now that we have the option of cataract surgery available in animals as well, that it's curable, but a lot of times it's just degeneration of the
Yeah,
lens.
yeah. Yeah, we actually had one owner insisting that her dog has cataract, and we were like, no, he doesn't need surgery. You can just,
It
he
just
doesn't need
let's
anything.
just do the surgery for fun.
No, he's fine. You can see he's fine. You don't need to do anything. So yeah,
Okay, so let's just come down to, so we spoke about cataract. Also, let's talk about vision loss. Like sometimes a lot of people don't realize, but their pet or their dog or cat hasn't been able to see for a long time, but they just haven't realized it because the pet has kind of adapted as
yes,
they used
absolutely.
to their place. So,
Yes,
they don't realize that actually, they can't see. So,
yes,
there might be some initial telltale signs so that people would,
yes,
you have to obviously pay attention to their
yes,
behavior and how they're moving. So,
right.
how would you know that there is a vision impairment?
So I mean, you can sometimes what they do is it starts with night blindness. Some of the retinal issues can start with night blindness. So people need to remember that not all blindnesses are because of cataract. There's a retina at the back which can degenerate, which can detach with age or with other breed predispositions, and that can cause blindness as well. So there can be an acute blindness with detachment or with something called as SARDS, which is a very nasty thing, and having SARDS is quite nasty, where they just go blind overnight or in 4 5 days, and
Wow.
there's nothing really that you can do about it. So, acute blindness is very depressing for the dog, and they usually show signs of suddenly bumping into things. But progressive blindness can be missed most of the times by the owner. So, what you can do, it usually starts with night blindness. So you can see how your dog is walking around, move a bit of furniture around and see. So dogs are, as I said correctly, adapt and map their surroundings as well. So if you move around the furniture a little bit and do a little bit of challenging and see how the dog or cat is maneuvering around the obstacles,
Hmm.
that's how you can see whether they have. And most of the times, night blindness can progress to day blindness.
Hmm.
So if diagnosed early, we can't really cure the disease. It's called PRA, progressive retinal atrophy or degeneration. But we can at least delay the process.
Yeah.
And with retinal issues, unfortunately, we are not into surgery for retinal issues yet. But these degeneration kind of diseases, they don't really have a cure. But the owners need to understand that uh, blind dogs or cats do very well. They cope very well with blindness. They just need a little bit of help, assistance from your side. As long as they are not in pain, I mean, blindness combined with pain is something that needs to be addressed. But just blindness is they develop a sense of smell, of course, they map their surroundings, and just a bit of assistance, they cope up very well.
Yeah. Yeah, yeah. I think they're way more adaptive than
Definitely.
humans can be. Um, so I think let's come to some of the breed specific issues that we've seen. Like
Yeah.
we like pugs. I think
Pug.
are a disaster waiting to
Pitbull, yeah,
happen.
yes,
Pugs,
of
Shih
course.
Tzus, Lhasas.
Pugs and Shih Tzus are the most notorious breeds that we've seen. It's a nightmare to have a pug or a Shih Tzu with an ulcer. It's
Yeah.
very yeah, so breed issues. There's something called as brachycephalic breeds, breeds which are flat faced. So you have your Shih Tzus, pugs, sometimes a Lhasa or boxers. And recently, these French bulldogs have been such a rage, and they have absolutely huge pop eyes that are about to pop out, kind of. It's really sad for them to have eyes and a whole lot of issues like that.
Have
So
eyes.
these are no, yeah. Have I? Yeah, I mean it's a disaster
I mean,
waiting to
their
happen.
face has gone in, but the eyes are still the
I
same
have like
shape.
frog eyes. Yeah, so these breeds are they give us nightmares. So these are called brachycephalics, and they get a thing called as brachycephalic ocular syndrome, where your eyes are exposed to the environment, your tears dry up. Sometimes the eyelids can kind of turn inside, that's
Yeah.
called as entropion, and many other eyelid issues as well. So a whole lot of things which contribute to their eye problems, and usually we see them with dry eye or ulcers, and such breeds they tend to, in spite of medication, sometimes their ulcers can go downhill. So even a superficial ulcer or a deep ulcer should be addressed and quickly, diagnosed and addressed and not taken
Yeah.
lightly. For sure.
Yeah, no, I feel like anyone that has a brachycephalic breed for whatever reason has to pre-book an appointment with an ophthalmologist, like right from the beginning.
Yeah, yeah, absolutely. They're crazy. So that's brachycephalic. They also there's one more thing that Shih Tzus get is it's kind of hair which grow in from into the eyelids, basically, from the eyelid margin, and that's called as distichia. So your eyelashes or cilia growing from a wrong location and into the eye and irritating them.
Yeah.
So that is very very commonly that we see in Shih Tzus.
And you can there's surgery for that.
There's surgery for that, absolutely. I mean, plucking those hair is not a hair, it is going to come back. It needs
Yeah.
a surgical intervention
Yeah.
for that.
So yes, we do have a lot of solutions for some of the breeding disasters that have happened.
Yeah.
But obviously, it's something that needs to be addressed at a much larger level.
Mhm.
We won't get into that. Let's talk about ophthalmic emergencies. Like when do people need to rush to a vet? Sometimes they'll be like, no, no, I just wait for a day and watch. But
Yeah.
the eye is beyond saving after that point.
Right, right. Ophthalmic emergencies that we usually see are deep ulcers. So the cornea, which is the front portion of your eye, is a very thin structure, and sometimes it can, there can be an ulcer over there which is very deep. So about if it's more than 50 to 70% of the cornea is gone, then that needs to be for sure. So it's called as a desmetocele sometimes, and this is a surgical emergency. So the faster we do that, it can again be vision saving. The procedure can be vision saving. We do a grafting procedure for that, and when the normal cornea is kind of filled over that ulcer, and that's how we suture it, and that's how we do it. So that's one thing. Proptosis, where the video is stuck. Huh.
Yeah, it's back. I
Uh,
think just repeat what you said before proptosis. I think just
yeah,
repeat
so
that bit because that's where you got stuck.
okay. So for that, for a deep ulcer or a descemetocele, we do a grafting surgery where we take a normal part of the cornea and slide it across over the ulcer and suture it. Yeah,
Yeah.
so that's one thing. Other things that we see called as proptosis, is that eyeball kind of pops out. It's again a very nasty thing or a gruesome thing to look at. and it's mostly seen in again brachycephalics, where their eye socket is so shallow it hardly holds the eyeball inside. So
It's
any
ready to pop out at any time.
so any so proptosis is one thing, and we usually kind of slide the eyelids over the eyeball. We never push the eyeball inside. We slide the eyelids over the eyeball and suture it. So that's our usually, and we have to see whether there is vision in that eye. We need to communicate that with the owners first. Sometimes it's so long gone that there's no point in keeping that eyeball.
Yeah.
So
Yeah, no,
yeah,
we've had cases
pet
where the
parents,
eye has just been out and dry for a while. And
yeah,
yeah, obviously there's no chance of saving that eye then. But
yeah.
they still they do very well without the eye as well.
Yes, of course. When that happens, actually, like for our pet parents, if you have a dog whose eyeball has recently popped out, start putting lubricate the eye as much as possible. If the eye dries out, that's really bad prognosis. You can keep putting a lubricant gel every hour or every 15-20 minutes. You get to a vet close to you. Keeping that eye moist is very important.
Yeah, yeah.
Yeah.
Definitely. I think that's very helpful for even vets and also people at home to know
Yeah.
uh what they should do in such a case, and obviously immediately take it to the vet as soon as you can. And also any other ophthalmic emergencies that you want to talk?
Yes. So I wanted to talk about diabetic cataract. Um, because most of the times pet parents think that cataract is a slow progressing condition. It is of course a slow progressing, but with diabetes, it can the lens kind of imbibes a lot of water and it can swell up inside and it can rupture. It's like a bladder rupture. The more urine it can just rupture. So that is quite again a disaster for the cat if not if the lens doesn't come out. So that is an ophthalmic emergency that we have seen with diabetic cataracts. The lens swells up and we need to do. We had one dog where the lenses were about to rupture. Unfortunately, the owners decided to do the surgery. We saw the dog in the afternoon and the lenses were out by evening. So that time is again
It's
a,
yeah,
a
it's a
very
savior. Yeah.
yeah. So that is one thing. Diabetic cataracts are an emergency. Anterior lens luxation. So the lens coming in the front of the eye, in the front chamber. We've seen that in a few breeds, most commonly in Cocker Spaniels actually, that the lens falls because with age what happens is the lens can become unstable, and with a little bit of pressure or some activity, it can dislocate in the front. So that is again a certain emergency. We need
Mm,
either to assess the animal and then get the lens out or explore other options for
yeah.
that. So and one thing again, one tip, if one lens hits, there's a high chance that your other lens may sooner or later dislocate in the same way. So they need to be vigilant about that and speak to their vet about what they can do. There are eye drops to not prevent dislocation, but at least to the lens shouldn't fall in front of the eye. So there are drops to prevent that from happening, which is
Okay.
very
Okay.
helpful.
That's great. Okay, and I think just a word of advice to everybody watching is that never try to self-medicate or
Yeah.
self-diagnose any of these
Yes.
things,
Yes.
because it takes a lot of hard work and dedication to even get to where we are, and obviously, uh,
Yeah.
it's something you could be doing more harm than good. So
Absolutely.
always seek professional advice before trying to do anything at home.
Yeah, that's for sure. I mean, there's one thing that you can do. I mean, you'll also get to spend that much time looking at your pet's eye is clean their eyes every day with moist, warm cotton, basically. Don't use tissue. Tissues can be a little harsh on the skin. So, two things that you can do is clean with warm water and do warm compresses. It really helps. them. So at home you can start if there is issue, you can start doing these two things very safely till you can uh, take take your pet to the vet or to an ophthalmologist.
And I just actually just want to very quickly add a small thing that we very commonly see in rescued stray kittens that we find on the road.
Mhm.
Like it's I think the most common thing we see is
Yeah,
the the big watery, dirty, bulgy eyes with a lot of
yeah,
glue stuck on them, and a lot of people think "Ke iska to aag gaya,"
yeah.
like the
Right. I actually have a picture for that. It was the same scenario that you told us just now.
oh
So
yeah,
it's a horrible looking eye, but this is a very common thing in all cats is a feline herpes virus, and it's all cats are carriers, and they sometimes when they're kittens they can get an episode like this. It's horrible, but it is we can turn this around with medication. If it is
yeah,
feline herpes virus, we can definitely turn it around. And pet parents should remember that your cat will always be a carrier of the virus. So, at any point, if the immunity goes down for some reason because of stress or whatever, there can be a tiny bouts of eye issues like this again.
yeah.
So,
No, that's how I found my own cat. You remember how he was.
yeah, yeah,
So
good.
yeah, it's something that obviously needs immediate treatment by a vet. So don't take it lightly because again, if it is left just like that, it's the
This
cause.
can go downhill. Yeah,
Yeah, because
but
we
with
have
cats,
had a
with
lot
this,
of mainly strays that no
yeah.
one is really looking at where the eyeball has to be eventually
Yeah, that
removed.
happens because they get a dry eye with the herpes virus, and they really go at it. It's based the going bad is basically self-mutilation because it's so dry and irritating to just go on scratching and making it worse. So that's how they end up with this big eyeballs jutting out, which have to be eventually removed.
Yeah, just wanted to know if anyone has any questions, y'all please feel free to ask us. And Dr. Pallavi can either answer it now, or if you want, you can DM the iVet or comment on this post so they can reply to you. If you have any questions right now, we're open to them. I had one question that one of my friends had asked me. It was about cherry eye. Um, the dog has had cherry eye for a long time.
Right.
They were just wondering about the pros and cons of doing the surgery. Like, can the cherry eye just be left like that, or is surgery always necessary?
Mhm. Yeah, that's an excellent question. Cherry eye again is very commonly that it's one thing that we see at the clinic. It's basically a tear gland, and the gland pops out. Okay, so anything in its abnormal location is not really good. It has to go back to its normal location for it to function normally. So I wouldn't advise to keep it like that. It has to go back in. Firstly, it can cause the gland can rub over the cornea and cause corneal issues or an injury, and they can almost always get a dry eye because their gland is popping out like that and it's not functioning properly.
Yeah,
So that has to go back in. Never ever remove a gland. Never. We
yeah,
always try and pop it back in, and it usually works. I mean, one surgery usually
yeah. And I'm sure
works.
if it's left out, it'll probably dry up and cause other infections and whatnot.
Yes.
It's obviously
Yeah.
irritating to have something like just
I know.
popping out of there.
Yeah.
So, yeah, so that is also another breed specific thing.
Yes.
Cherry is pretty
Cherry
common.
eyes are commonly we have beagles, we have cocker spaniels, or all those breeds with droopy
Droopy
faces,
eyes. Yeah,
mastiffs and Saint Bernards. That
yeah,
they come out with cherry eye. And again, for pet parents, if one gland is popped out when they are a puppy, it's most likely that the other gland is coming out. Yeah,
it's just
sooner or
waiting.
later. Yeah. So one tip that I would like to give is we tell our owners is shift them to a body harness rather than putting a leash and a collar, because any pressure on the neck can also predispose your pet to have that gland out.
Yeah,
So
people
body
always
harness is,
wonder why the crazy dogs who are pulling at the leash always come back after a walk with red eyes. It's obviously they're joking.
yeah, that's joking.
So yeah, please, yeah, body harnesses are important,
Body
and also
harness.
also behavioral training, please. It is also very important to do as when they're puppies. Okay. Yeah, this has been awesome. Have we missed anything?
Mm, no, think
I
so.
think we've pretty much covered all of it,
Yeah,
and I'm so
I don't
happy
think so.
you came in today and joined. I'm actually seeing your face also after just it's just been too
I know.
long.
I
So
know.
so thank you so much. I think people have gained a lot out of this talk. I mean, and obviously they need to know that there are these facilities that are available for their pets. There are specialists that are doing great things in the ophthalmology field as well. So thank you so much, and hopefully I will see you physically soon.
Soon, I don't know when. Thank you for having me. It was lovely, to connect with you on this platform. I've never used Insta Live, so this was a new thing for me today.
It's something that I mean, I think the lockdown has kind of produced this whole, you know,
Yeah, yeah,
series,
yeah.
so to say. So
Yeah,
yeah, so it's a great way for to reach out to people and for them to even, know certain
yeah.
things that they probably didn't know before. So thank you so much. A lot of people are thanking you mostly, but I'm so happy that we did this, and I'll see you soon.
See you. Yeah, thank you.
Bye. Bye,
Bye.
everybody. If y'all have any questions, please DM us, or you can follow the IVET if you want to follow their cases and see the kind of work they do. So, thank you. Thank you so much, everyone. And I will see you soon with another talk. If you have any suggestions on what you want us to talk about as well, please let us know. I'm so glad that you all are here. And just one more thing I wanted to add before I go is that it's quite rainy, it's quite cold. So if there are any birds and animals in your area that need shelter, please let them have it. They'll go away as soon as the weather clears up. So thank you so much, and bye bye. I'll see you soon.